Hi, this is Just Be Well, the channel about whole life wellness. I'm Sult, a medical doctor and functional medicine practitioner.
And I'm Elizabeth, a registered nurse and whole life coach.
Yeah, and sorry about the blown out background. But here we are. So on Monday, we started talking about food allergies, food sensitivities, food intolerances. We talked about diet and the need for a 5R gut restoration program. We talked about how on our YouTube channel you can find actually 6 videos about the 5R program because there's an introductory video and then there's a short video about each of the 5.
Hi,
Fran. Hi, Yolanda.
Hi, Fran.
Tonight, we're going to talk more about diet, we're going to answer your questions, and we're going to go into a few supplements and things in addition to what we already talked about on Monday. And then on Friday, we're going to talk more about either sublingual immunotherapy, SLIT, it's called, sublingual immunotherapy, and LDA, low-dose immunotherapy, and LDI, low-dose, or LDA is low-dose allergy therapy, and LDI is low-dose immunotherapy. So that's sort of the agenda, and let's just sort of review for a minute about allergy in general. So allergy is always the only problem, and there's never anything else that's going on, right?
Nope. No,
and of course right now the giant diesel thing decides to come driving along the road right behind us.
There's a big bobcat hauling something over the bridge.
Yep. So
a lot of times when it comes to allergies, when you think about it, all of a sudden, out of the blue, you became allergic to something, or you've noticed over time, like you just don't tolerate that anymore, a specific food or food group, or maybe you're just feeling crummy, or you're having outbreaks of eczema or other skin disorders.
Or acne.
Yep, acne. Acne is, I think, I'm going to speak personally, for me, it's a huge one. I know I'm having foods that don't agree with me when I break out. So it all kind of goes back to the gut, which is why Dr. Sult brought up the 5R program right away, because it is a whole life restoration program for your gut. So really it targets the issues of what's causing you to have these food sensitivities and tolerances in the first place.
Yeah. So it's really this imbalance at the level of the gut mucosa. And really the first line of defense is your microbiome, which is this teeming ecology of bacteria in your gut. It actually adds to the mucous membrane and the mucus of the mucous membrane to create a barrier, a thick barrier that traps antigens and prevents them from getting to the cell surface where they become recognized as allergens.
Almost like a seal, if you think about it, like that oil seal that stops things from getting through. Yeah.
Like pouring the wax on top of the preserves when that's what my grandma used to do. I don't know, do people still do that? Pour wax on the preserves?
I haven't done that.
Okay, that must be really old.
Yeah.
Anyway, Doris, hi.
Hi, Doris.
So that's really, an overview of what we talked about on Monday, and you can go back and get a deeper look at that. And then there's sort of multiple layers of things that we can do to try to manage allergy and allergy symptoms. Now, antihistamines, as an example. Antihistamines, there are drug antihistamines and natural antihistamines, and we'll talk about some of the natural ones, and then just down-regulating inflammation in general. But antihistamines are kind of the last step, right? If fixing the gut is among the first steps, antihistamines are among the last steps. So you've got a tissue, and you've got this mast cell, it's called. It's kind of white blood cell. And they get very irritable when they're exposed to these allergens. And they release histamine. And histamine goes down onto these tissues and makes them swell and turn red and get inflamed and all that stuff, and it makes your eyes water and your nose run and sneeze and all that stuff. An antihistamine is sort of like a protective coating on those receptors on the tissue. So after the mast cell has released all of its inflammatory chemicals, that's where an antihistamine works. We can work far upstream from that. So quercetin. Quercetin is a supplement that is actually the parent compound for a prescription medicine called cromolyn that is also a mast cell stabilizer. And what that means is it makes the mast cells less irritable so they don't release that nasty stuff in the first place. So quercetin is something we use a lot of. We can show that later. And then guess what? Fish oil. Anybody ever heard me talk about fish oil? Fish oil is like a panacea unless you're allergic to this stuff. But fish oil downregulates a whole host of inflammatory cascades. So most inflammatory cytokines, they're called, or inflammatory chemicals, we'll say, come because an enzyme cleaves a little bit of fat off of a cell wall called arachidonic acid, and that arachidonic acid enters a cascade that creates all these inflammatory chemicals. Well, fish oil blocks that process, and fish oil feeds into anti-inflammatory cascades. So it has a double effect. It reduces the inflammation cascades and it upregulates the anti-inflammatory cascades. And then vitamin C. Vitamin C is also an anti-inflammatory, it's an antioxidant, and it has antihistaminic properties. So the combination of fish oil and vitamin C and quercetin, and then what else is in here?
Stinging nettle.
Yeah, I was going to say, that's what I was thinking. Stinging nettle. Stinging nettle has a whole... And bromelain, yeah. Bromelain is there mainly to enhance absorption, but stinging nettle is interesting. Stinging nettle helps with prostate health, probably because of its anti-inflammatory properties. It helps with allergy because of its anti-inflammatory properties, also because of its antihistamine and its mast cell stabilizing effects. So there's a ton of supplements that can help. Hi, Carol. Two Carols.
Hi, Carol.
The Carol
Hi,
twins.
Thanks, Carol. It's actually the sunlight is shining off of the river through the house from the other window, so I think I'm getting a little bit of a glare, so it's just extra lighting.
She's got one of those beauty mirrors right here. Yeah.
So it's just the right lighting. But
Just the right lighting, yeah. So anyway, that's a few supplements that can help. There are many others, but
and
go ahead.
Actually, the few supplements, it's actually... Just Be Well has a supplement that has, minus the fish oil, all those in one supplement that is specific to allergies.
What's that?
I have it in my lab.
Just happen to have it in your lap?
It's called Histopro, and I'm going to... Histopro?
It used to be called Allergy, and the
Allergy.
FDA didn't like that name, so we had to change it. You can't have a name that implies structure or function because the FDA doesn't allow you to claim that any product is designed to diagnose, treat, or prevent any disease. So this certainly is not, and it even says that on the label. But that's true of all. What's that? Well, that's my mirror. That's my window. I thought somebody was showing us something, and it's just my craziness. Anyway, so just want to make that she's showing you a supplement. I want to make it really clear that there's an FDA issue with supplements. So anyway, this has, what does it have in it?
It has the stinging nettle, and it also has the quercetin that Dr. Salt talked about it. It has vitamin C, and then it has the bromelain to help just with the absorption of that all. And, NAC.
N-acetylcysteine. You have to say that carefully.
Yeah.
N-acetylcysteine, NAC. So NAC is a precursor to glutathione. And glutathione, so NAC is an antioxidant all by itself, but glutathione is the most important antioxidant that you actually make inside your own body. So we normally think of antioxidants as like vitamin C and vitamin E and selenium and whatever else. And those are things that you can't make and you have to get from outside. But selenium you make in your body. but sometimes you use it up really fast. Anytime you're under oxidative stress or toxic stress, because glutathione is also used to detoxify things and get rid of them. So NAC helps your body have the spare parts to make more glutathione. Plus, there's some concern that preformed glutathione can't get inside your cells. It can only be in your plasma, which is still helpful, but the NAC gets inside your cells and helps your cells make glutathione. So that's a very nice supplement for allergy. But again, it's a layer, right? It's an elimination diet. It's a 5-hour program. It supplements. And then it's what we'll talk more about on Friday, which is SLIT and LDA and LDI and stuff like that. So, so the issue, again, from my perspective, is that food allergies are almost always a symptom of some other thing gone haywire. Yeah. Very frequently, as a matter of fact, we will do, well, I hardly ever do these tests anymore because they're kind of expensive and they don't give me that much good information, but I used to do IgG food sensitivity panels. And when we would see tons of them at low levels of concern, it really just told me that you have leaky gut. Yeah. Well, there's so many other ways to figure out you've got leaky gut that don't involve spending a whole bunch of your money, that most of the time we can figure that out clinically, put you on a 5-hour program, and then, and only then, if it didn't work, do we start doing a bunch of expensive tests. So I like to start without a whole bunch of expensive tests. But, you know, when people have got a bunch of stuff going on and they're already doing good diets and they're already taking a bunch of good supplements and they're already doing detoxes and they're not getting better, that's the time to start doing tests. Like some of you on this video. How come he just said he doesn't do tests? Why do you order tests on me? Because you're special. That's why. Because you're special. So anyway, that, you know, so but it's this layer. It's always a layer, and it's always whole life. It's not, oh, I have allergies, so I'm going to take an antihistamine. That's fine if all you're looking for is symptomatic relief. If you're looking for something that's actually going to get rid of your allergies, then it's a whole life approach. So it starts with dietary change to figure out what you're really sensitive to, and also to get rid of those allergens that are inflaming your gut so your gut can heal. Add on top of that the 5-hour program so that your gut heals bigger, better, faster. Add on top of that supplements to manage the symptoms of the allergy, and then layer on top of that maybe something that's either going to manage the allergy in a more traditional way like SLIT, or try to downregulate the overabundant immune response, balance what we call Th1 and Th2 responses with something like low-dose immunotherapy or low-dose allergy therapy. So kind of this whole wind up, and we'll talk. I just remember we did do a video the other day, a couple weeks ago, about LDI, but it was really more related to its use in the treatment of like Lyme and autoimmune disease. So this Friday we'll talk about SLIT, sublingual immunotherapy, LDI, low-dose immunotherapy, LDA, low-dose allergy therapy, and what that can do. And the wind's coming up, but it's a very pretty wind chime, don't you think? So, any questions about any of that? Love to entertain your questions. And otherwise, it's a beautiful night, and you guys should be outside, not listening to us. You do have very much better lighting than I do. I should come over here. See how much better I look over here?
It's true.
Yeah. All right. What major blunders did I make? What do you have to say?
None.
Well, no, of course. How could it be any other way?
You know, I think some people just, you know, when it comes to the testing, well, how do I know what foods to eliminate from my diet? Where the elimination diet is a great way to pinpoint the things that are disrupting your system.
It's actually the gold standard. The blood test, the skin pricks, all that stuff, that's a secondary thing. The gold standard, elimination, provocation, diet.
Yeah, so and then when you are on the elimination diet, not only are you eliminating those foods that can trigger inflammation that people are most likely to be allergic to, like dairy, wheat, gluten, specific grains, soy, a lot of preservatives. Not only are you eliminating them, but you're also giving yourself a whole foods diet that is healing your gut at the same time. So after you've been on the diet for 6 weeks, you can start to reintroduce things, and then that's when you know, okay, this specific food group is still causing me difficulties.
Yep.
And that's when you remove it for the next 3 months.
Yep.
So it's a...
Yolanda has a really important question, but you need to use your special finger.
He needs me to read it.
Well, I need you to push that blue button.
Okay. What do you recommend for people who have actual allergies? I'm allergic to different types of grass and take a daily pill called Singular.
Yeah, so by the way, Singular is related to that quercetin we were talking about earlier. It's it's actually a slightly different but related. Anyway, so SLIT can be a very good option for that. Sublingual allergy therapy, where you're putting little drops under your tongue every day. Also, low-dose allergy therapy, LDA, can be very helpful for that. In fact, there's some evidence that LDA has even improved people with anaphylactic levels of like peanut allergy and that kind of thing. And my puppy's barking his head off. And we'll talk more about that on Friday. So don't miss it. All right. But that's a great question, and thanks for leading us into the talks on Friday. So again, Friday we're going to talk about various immunotherapies to manage allergy symptoms, whether it's food allergies, environmental allergies, even autoimmune allergens, and weird things we can do like create what are called autoallergens. You'll be there. Thank you, Yolanda. Hi, buddy. Here, why don't you come on out? Somebody locked us out here. Come on, buddy. He just got groomed, so he's... oops, sorry. And then I just shut the door on the other one. Buddy. This is one of my buddies. Come here. Hey, don't knock anything over.
Knock the camera
He's going to
over.
knock the camera over. Come up here. Yeah, hi. So, now that we've stooped so low as to bring our pets online, and since he's going to knock the camera over, we will say good night. And we'll see you Friday, and hopefully we won't be talking about what we're going to talk about and suddenly realize it's 5 after 7. So we'll see you at 7 o'clock on Friday, because we have no social life.
Sweet babies.
Sweet babies, that's right, they are. Especially
They are
now,
sweet,
they just came back
but-
from the groomer, and they actually smell nice, which is kind of rare for them because they go out in the river. All right. See you on Friday at 7. Yep. See you, friend.
Bye.
See you, everybody.